Hey guys, so this video is on spine osteoarthritis. Really what this video is going to entail is all degenerative conditions of the lumbar spine. So the three big kind of pathologies that I like to think about when I think of degenerative spinal conditions include degenerative disc disease, which is the gradual narrowing of the disc space between the vertebral bodies. I also think about spinal stenosis, which is the narrowing of the foramen or the little hole that the spinal nerve root escapes from. And lastly, I think of facet joint, or the joint out to the side of the vertebral body's osteoarthritis. So the facet joints are those joints that allow us to side flex and rotate. And those joints, like any other joint, can kind of get that wear and tear over time. So all three of these conditions are going to present just a little bit different, but the biggest thing to note here is these are typically those kind of gradual onset conditions, those conditions that happen over time as we age. So typically what we're going to see with all three of these conditions is generalized stiffness of the lumbar spine. It can either be bilateral or unilateral. You might feel it more strongly on one side, or it might feel more central to you. With something like spinal stenosis, you may see radicular symptoms. So radicular symptoms are those symptoms kind of away from the source. Typically you're going to see pain kind of in that upper glute and down the leg a little bit. You may also see some kind of upper glute pain with that facet joint osteoarthritis, as it typically can kind of refer to that region. Generally, what you're going to see is pain is going to get better as we sit, as we rest, as we bend our back a little bit, and it gets worse with standing, walking, or increases in activity. So typically, these are the folks that have increase in pain when you're out walking for a prolonged period of time. Again, you may or may not see those radicular type symptoms. The big thing here to note is a lot of times we can get this stuff better with conservative management. So with physical therapy, you may see some major improvements in your pain and in your function. Of course, there are some cases with these conditions that can be really kind of helped with more invasive measures. So in those extreme cases, so those cases where we're seeing significant neurogenic changes, meaning we might be seeing changes in bowel and bladder, we might be seeing changes in motor function, severe sensory deficits. Those are the cases that we want to take in a little bit of a deeper dive, and maybe see a physician to see if something like an injection or an ablation or potentially something even more invasive would be kind of warranted in those cases. Oftentimes, if pain is your biggest symptom, physical therapy can really help out the function and the volatility of your symptoms. So kind of go through our regimens here, see if we can get you started on your rehab journey, and see if you can kind of make the next steps in kind of recovering from these conditions.